Welcome to Skinside Out, where we uncover the science, trends, and truths behind skin health. Your trusted guide to the world of dermatology. This podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional.
Welcome to Skinside Out, where science meets beauty. I'm your host, Dr. Zain, with Heather, Courtney, and special guest Crystal, who's joining us. She's a licensed aesthetician and a former med spa manager. So it'll be unique to see her perspective working in different environments, such as a med spa versus some medical offices, related to our topic today, which is who is performing your aesthetic treatment. So in the aesthetic industry, there are a lot of different professionals in the space. So we're going to go into the various professionals you may encounter, what their credentials and training mean, and how having that knowledge will help us be savvy consumers in choosing who we choose for these specific procedures. So I am a board certified dermatologist, so I will speak upon physicians. So physicians are medical professionals who have completed 4 years of medical school, either at an allopathic or osteopathic medical school, and then further have training in residency in a specific specialty. They can also go on and do fellowships as a subspecialist within those specialties. So as a dermatologist, I did 4 years of medical school, then I did a year of internship in internal medicine, then I did 3 years of residency in dermatology, then I did a fellowship in cosmetic dermatology as well as Mohs micrographic surgery. So a lot of years of training, 13 to be exact, after graduating high school. So it's a long road, but I thought that I received excellent education and training. We really do see a lot in those years, and it really made me a better clinician that way. So I do think that training does matter, education does matter. And if you're seeing a physician, you know at a minimum they've had 4 years of medical school and some subspecialty or specialty training afterwards. So, and you have to pass a lot of tests and show competency. And there's a lot of, testing and, rubrics that we have to follow and in order to be board certified. So that's another thing that, a lot of people don't understand. What does board certification mean? So you can be a physician and not be board certified, meaning that you did not sit for or you did not pass a test that certifies you in that specialty. So I've taken 2 boards, one in, for dermatology, one for Mohs micrographic surgery. But prior to that, you actually have to take board exams throughout medical school and during training to even qualify for that. So there's a lot of testing, a lot of education involved, but that ensures that the public is receiving qualified treatment from a professional who's gone through that vigorous training.
I think that's super obviously important. What we find, in the medical field sometimes that's funny from our standpoint rather than the patient's standpoint is that, yes, someone will be a doctor, but maybe they have not gone through and done these certifications. For example, I know there's a Mohs surgeon close to us who has not board certified. And so even though you do have this, I guess, community of physicians, everyone has had their own separate training. And, I think it's so important to go on their website, check out their bio. Your physician should be saying where they studied school, what fellowships they've done, all of these things so that you know what they have specialized in. Because technically any doctor can open a practice and say that they're a specialist in that, but without those credentials, you have no idea.
And bringing it back to aesthetics, there are physicians who are not trained in what is called the core 4. So these are specialties that have training in cosmetics during their residency training. So that includes dermatology, plastic surgery, facial plastic surgery, oculoplastic surgery. These are individuals who have gone through training and have had supervision and actually performing cosmetic procedures while in training. Like, these folks did not go through a weekend course and learning, how to inject Botox and filler and all this stuff. We had to really learn the anatomy, learn the procedures and learn how to avoid complications. And that's a really big part of the education.
Yeah, going off of that, especially in aesthetics, a lot of med spas that are being kind of supervised by primary care physicians or, you know, I think a lot of people are trying to get into aesthetics. There are bariatric surgeons who are now doing aesthetics. And so I think really that credentialing makes a huge, huge difference with the background.
And supervised by a doctor is a very loose term, very loose. Like we could be talking about a doctor who's never on
Out of state.
He could be out of state. He's not even on the premise. So if something goes wrong, what we're going to call and say, oh, what do we do? It's a very loose term.
Yeah. And Crystal, I mean, you're a med spa manager. Like, who was your supervising physician?
Yeah. No one.
That's scary. We shouldn't be laughing.
There would be no one there. You know, there was someone that we could call that, you know, was the person that's supposed to be supervising, but no one was actually present to supervise. So,
it blows my mind.
Yeah.
And it's scary because, first of all, some of these owners or these supervising docs don't have any training in the procedures that they are hiring someone else to do. Some of them are not even the owners. They are just renting out their medical license, getting a little paycheck, which in my opinion is crazy because my medical license is worth way more than any little stipend and potentially losing that in my livelihood because of any like lawsuit that can happen. It blows my mind. So I always check credentials and education, and I would always question, hey, why is an ER doc running a med spa? Why is a general surgeon doing this? You know, is it for passion for skin? I don't think so. What do you think the motive is, guys?
Money.
It always comes down to the dollar. So follow the money. And, you know, like people think that aesthetics is just easy money. It's not. It requires, and you know this too, like it's a difficult and there's a lot of competition. You have to be good at what you're doing and provide results because, you know, consumers are really savvy. They have a lot of different options. And what I focus on in my practice is expertise and safety. I think you can't compromise on that. And unfortunately, like a lot of these facilities really don't care. They're just trying to draw patients in with their Groupon deals. And, you know, like you don't even know who's treating you and what their credentials are. That's the scary thing. Is like sometimes people just walk in and, hey, I'm going to get my face injected. And it's crazy.
There's definitely a lot of people who use like Groupon to get different deals. But I think in the long run that people who can keep their patients, I think makes a huge difference because if you're seeing results and you're doing these treatments effectively and appropriately, you're going to get those, you know, results that you're looking for. And so maybe technique plays a different role too. And as far as keeping those patients and keeping them satisfied.
On the flip, you know, you don't want to cheapen your care either. I mean, you're talking about procedures that can have long-lasting complications if done incorrectly, and when you value your health, you don't really want to take the cheap end, the Groupon that's a $100 laser hair full body. I mean, that's crazy. That's crazy.
And guys, this is your face,
right?
Yeah.
And I know in the med spa, you know, running the med spas, there has been many times where the patient care isn't even a priority at all. Like the focus, I know managing, the focus was always revenue and sales, the money.
It's a business
period.
at the end of the day, right?
Yeah.
But the thing is, you know, as a physician, I've taken an oath to do no harm and to treat my patients and do what's right for their health. And, you know, I don't know if some of these other clinicians even took an oath, whoever they are. So sorry for all the shade, but that's how I feel. I'm very passionate because I get so angry when I see a patient who has been harmed and they're coming to us for help and it was preventable, right? So, I mean, a lot of these complications stem from, you know, poor training or no training, lack of education, and really looking at profits over health. And I do think that, you know, it's an ethical dilemma in our field. Unfortunately, like, it is a business, and at the end of the day, they have to keep their lights on. I get it,
Right.
but at what cost?
Yeah,
Right.
pick a different business, like do
Yeah.
hair or something. Hair grows back.
I mean, even with the credentialing aspect, call it a medical oversight, but I mean, there was a time that we had a patient that got a laser treatment done. Her face got burnt, and come to find out that the person that did this treatment wasn't even actually certified. They never actually checked during her hiring process. So
I'm sure the attorneys had a field day with that one.
yes, very much so.
Yeah.
And I'm not trying to say that all aesthetic, physicians are bad if they're not trained in the core. There are some excellent practitioners out there who are artists. They invested the time. They went to do that extra training. So I'm not going to speak poorly about them. It's those people who just kind of get in there, take shortcuts, and it is complex. It's not an easy skill set. Being able to make sure that you know the anatomy inside out, how to manage complications. You should not be doing any procedure that you cannot manage their complications.
Yeah.
End of story.
Yeah, especially toxin filler. I mean, not only are you concerned with obviously technique and anatomy and where you're injecting and why and how, but the artistry of it. Not everyone has an artistic eye. I've worked with providers who have technique down pat. They know how to inject steady hand. They know the planes, but that artistry is not there, and they don't know necessarily where they should fill in, what looks, symmetrical. So it's not for everyone.
Yeah.
I've experienced this myself. I've had the duck lip.
Ooh, not the duck lip. Quack, quack.
Yeah. And again, that's another example of just technique and, filling out instead of being able to kind of fill in. I mean, we've utilized, what do they call it? Like the Russian technique with the insulin syringes to really get in there and get a nice control on where that is being injected, the filler. So yeah, not everyone has been trained. You can't just stick a needle in and put how much product to push in at a time. I mean, these are all little key things that I think people don't realize or understand, and especially people who are hoping to make a quick buck.
Yeah, people think it's so easy and it's like a commodity almost. And they don't realize that what took me 15 minutes to transform someone's face took me over a decade to learn. And it is not in a vacuum. And when patients, say that anyone can do this, I can go to any med spa and do this. I'm like, sure. I mean, take your chances. But at the end of the day, you pay for expertise.
Yeah. And there's so much variability. I think that's what a lot of patients don't understand too. I mean, besides just the credentialing, variability on lasers, we've talked about it before, not one laser fits all. You want to make sure you are going to someone who understands your skin type, is going to use the right laser on you, going to use the right settings on you. Again, someone that's going to know what to look for any complications. Oh, maybe this is too high, maybe it's too low. There's just so many things that I think play a part that people don't realize.
Yeah. And even within the field of dermatology, not everyone receives the exact same training, right? So there are some programs that are really medical focused and have very little cosmetics training, and some that are heavily focused on cosmetics. And, there are times where you have to seek out opportunities to learn while you're in training, going to conferences. I used to be one of those residents. I used to go to all the conferences. I wanted to learn as much as I could about cosmetics and surgery. And I ended up doing another year of fellowship in New York so that I could master my craft. And it was probably the best year of my life in terms of my education, because I really got to perfect my craft and see a lot of patients, get a lot of experience in a short period of time. So, I mean, I did a dual fellowship because I wanted to be the best at what I did. And, not everyone has that. So, I think that, seeking the best care requires a little research on consumers' part. So that's also important. Now that we've kind of discussed what physicians do, let's talk about APPs. And Heather is our expert in that.
So yeah, I'm an APP, an advanced practicing provider. So that is typically a PA, so a physician assistant, or can be called physician associate, or a nurse practitioner, or an NP. And so there are a lot of similar things that PAs and NPs do, but there's a very different way to approach how to get there. NPs, for example, you have to be a nurse first before you can become a nurse practitioner. I think there are a lot of schools that require, a certain amount of years of being a nurse before you can even apply to a nurse practitioner program. That really kind of develops this like bedside manner. As a nurse, you're always caring for that patient, and that's kind of the forefront of your care. And then you go to nurse practitioner school, and that can allow you to learn how to diagnose and treat different conditions. There are different types of nurse practitioners. So there's family nurse practitioners, women's health, geriatric. And I think a lot of family nurse practitioners can even then specialize additionally and go into other specialties like dermatology or any other field. PAs, you have to have a certain number of clinical hours or clinical experience, whether that's being a nursing assistant or an EMT or a phlebotomist before you go to PA school. And the nice thing is there is a wide range of experiences that you can get before you go to PA school. But during PA school, it's typically a 2-year master's program, and PAs are generally set up to be generalists, meaning that you have this overall kind of view on the body. You're trained to look at every organ together versus just being focused in women's health or just being focused in dermatology. You have that kind of total body mindset. Kind of going back to nurse practitioners, I think there are some schools that are online. And so that can play a huge role in how you're learning. And you can even still be working as a nurse while you're getting your education in nurse practitioner. Whereas with a PA, you're pretty much working full-time in school. There's no way that you could ever have a job while you're in school for a PA. And then I think the credentialing after schooling is very different. There's different exams that you can take, a specific one for PAs, there's specific ones for nurse practitioners. But I think the biggest difference in terms of practicing is that level of supervision. So PAs are always licensed under a supervising physician. So Dr. Zain is my supervising physician. Nurse practitioners don't necessarily have to have that. They can practice independently. They can have somebody that they go to like a physician, but they don't always necessarily need that. They could open their own practice if they wanted to. And so I think that's why I like being a PA, because I like having that supervision. I like having that person that I can go to for those expertise and kind of that knowledge and opinion on different things.
And that's philosophically why I chose to have a physician assistant in my office as opposed to a nurse practitioner. I know that there's a fund of knowledge that they have acquired. It's standardized. They will be working alongside me to do patient care. The thing that scares me a little bit about the nurse practitioner, like you even mentioned, you can do your schooling online. There's a lot of variability. And, many of these online programs are like diploma mills. Everyone passes. You're just essentially, the schools are just collecting their tuition fees. Mm-hmm. And there's really no standardization. And the fact that you can practice independently in many places, it's a little scary. And as a physician, I have come to respect how much I don't know. And it is scary. And I'm always on the conservative end and treating my patients. And I feel like if you don't get that full training and scope in a systematic way, and like things are done virtually, like I really don't think you even know what you don't know.
Yeah.
And that's scary.
You don't have that hands-on experience as much. And I think that's what PAs definitely get throughout their training is a lot of hands-on. I think also too, you have to be careful. You want to make sure you're going to a certified PA versus just a PA. So we have to take a certification after schooling by the NCCPA, the National Certification or the National Commission on Certification for PAs. If you don't pass that, you can't practice as a PA, or you shouldn't practice as a PA. I think that kind of helps solidify that medical model. PAs are trained with that medical background to help kind of diagnose and treat, whereas NPs are more focused on that nursing background with that bedside.
I'm glad you mentioned that about also taking the test. It just brought up this point. Separate of dermatology, there's a dental practice in this area where the owner was letting his son practice dentistry, and he hadn't done his test yet to make him like officially a dentist, but he had completed school and whatnot. Anyways, they're billing like insurance, they're taking money, they're all of this,
illegal.
and they got caught. And someone had just posted on Reddit, of course, that's where I find everything, that they posted that they had received a letter from the office saying, if you've been seen, was it eye doctor? It was eye doctor. If you've been seen at this practice, please go get your eyes rechecked because we can't guarantee that.
Oh, wow.
And you won't know.
You wouldn't know.
You wouldn't know.
Yeah,
You wouldn't
you just
know.
have this like
So,
faith.
yes, hadn't
Yeah.
you know,
No
someone
way.
said something.
Yeah.
You know what I mean?
Yeah, and because he was his son, I guess, and he felt, oh, he's done school, but he hadn't finished. He hadn't gotten his certification truly yet. He just was practicing. It's insane to me. It's insane.
Yeah.
They actually now have, so through the NCCPA, they have certification of added qualifications, or CAQs, which PAs can actually go in and take another certification test in dermatology or in orthopedics. And so that is something that's very new for PAs, and I think it's really going to help change that, especially for PAs who are in specialties. Just having that additional education and being able to say, yes, I am certified by, the CAQ in dermatology makes a huge difference too.
Definitely. And just highlighting your path, you did not start in dermatology.
Right.
You started in family practice, right?
Yeah.
Got experience, saw some dermatology, and then eventually got more experience in dermatology. And, by the time you joined my practice, you had a strong fund of knowledge. But the thing I like about you is that you still ask for help when you don't know things, because obviously I've seen things that you may have not, just based on my training, and you're not so proud to come up to me for help, which I think is collaboration, right?
Yeah.
We should definitely be working together for patient care. So I really do like that model where, I still have that ability to communicate with you, make sure that we're on the same page for patient care.
Yeah, I think working in primary care was really helpful for me, and I think anybody who is graduating as a PA definitely work in primary care first, because it gives you that foundational knowledge that you need to just know how everything works pretty much. And I think even though there are a lot of PAs in specialties, it's also important to know what they have done before, because a lot of PAs, there are PAs in dermatology that used to work in orthopedics. And so it's very different. They don't have that primary care or that generalist background to help you in dermatology or in the specialty that you're currently in. And so I think that makes a huge difference.
I think going back to what Dr. Zain had said also about like being able to ask for help. I always say this, that like I feel like a good provider should live with a little bit of fear in them. Like you never want a provider, you want obviously confidence, but as like a provider, you should always have this little bit of just fear so that you know that you are within your limits, like, and not taking on things that you can't handle or not doing things that I think when you run into these providers, they're like, oh yeah, I can do it. Like I do everything. I can do it. They take on more than they can handle. And that's where you start seeing those complications. And it's like their ego was just, in the way of like this patient's treatment, rather than saying, no, like I don't think this is in my scope. Let me refer out to this or that.
Yeah.
They just take on, and I think it's such a dangerous thing to have such an
I
ego.
have no problem with referring out if I don't feel comfortable with something. Like say something is affecting like, the eye,
Lower
and all the
breasts,
structures.
you'll
like,
recommend.
Exactly.
If you think something if it's laxy and it's not going to be fixed by filler or by a jelly roll or whatever, I've seen him numerous times say, you need a lower blepharoplasty, go see oculoplastic.
I know. I feel like I'm gaining so much more, like a wealth of knowledge being in dermatology versus being in just the med spa, which has been great for me because, every day is a learning experience for me.
Yeah. And, kind of transitioning into, estheticians and laser techs and their roles, and, Crystal just coming out of school as well. I mean, can vouch for this. Even there's so much variability in school for estheticians. Now, when I started as a medical assistant in dermatology. And so I'd gotten a little bit of that medical foundation. Okay, how does rosacea work? What treats it? What prescriptions are used for acne? If someone's on a topical chemotherapy for precancerous spots, do they need to come off for a peel? Like, how to incorporate that together. And then I started doing glycolic peels with my first practice, and that's what kind of transitioned me into aesthetics. If I had not had any of, let's just say I went to school, didn't have any of that prior knowledge, I only learned how to do a facial, which is not rocket science, how to wax, not rocket science, and maybe some like really mild peels, but we're talking like mandelic acid, lactic acid, nothing of a true deep peel. Yeah. So, and mind you, also in class, my peers are coming to me asking, what's glycolic acid? Can you use glycolic with a retinoid? I mean, these are things they don't really teach you in school. You're literally learning the bare minimum. And so when you think about your estheticians, I think it's so important to know where that training has come from, because if you've only been in a med spa or only been a massage envy doing facials for 4 or 5, it doesn't matter that you've been doing it for 5, 6 years. Yep. You don't have experience with perioral dermatitis. You don't have experience with psoriasis. That weird pimple that's not going away that we talked about last time, basal cell. I mean, there's no knowledge in that field to be able to say, hey, I can't treat this. Go see a dermatologist.
Yeah. And it's nice because, I know Dr. Husain is really great about, he'll be like, do you know what that is? Do you know what that means? And then I'm just like, and he'll just explain it in very detailed. So I'm like, oh, okay. I learned something new. I wouldn't have known that had I not been here.
And similar to Heather, Courtney also knows when to ask for help when she's not sure about something. And it's always better to ask than potentially treat a patient and cause an issue. So I do really respect that from both of you, that you guys are willing to come to me for help, to make sure that we get the best care for our patients. It shows how confident you are in asking for help when you do not feel comfortable. And not everyone has that. I have worked with people who literally will not ask for help. Their ego is in their way. And then we run into an issue. And then I lose trust in that provider. And I never wanted to get into that position where I lose trust in my provider. I don't want to send my patients to them. They're in my practice. I have to get rid of them. So it is really important. That's why I have such high standards for who I bring into my practice, and making sure that my patients are well taken care of. Because at the end of the day, my practice, my patients, and if they get hurt, ultimately the buck falls with me, right?
Exactly.
You actually care.
I do. Yeah. I do. So I do think, having a team that really is invested in their patients is so critical. I've worked in environments where that is not the case.
Yeah. Yeah. And, adding on to that with laser tech, which again is like a very generalized term. Now, I think also worth mentioning is that different states have different requirements. Okay. So for example, as an esthetician who is not an RN, I cannot inject Botox, filler, things like that. There are things, North Carolina is kind of weird. There are things that even though I legally can do CO2, I would never, because I don't feel comfortable and I think it's beyond my scope. That being said, in other states, for example, in Texas, you have legality of these estheticians who can inject Botox and filler. Colorado as well. So that's why I think it's so important, your state's regulations too, because if you live in a state where these things are allowed and okay, and you're getting injected by someone who, again, like I'm telling you, I'm assuming esthetician school's the same across the U.S. I did not learn any anatomy. I learned the epidermis, the dermis, and I did not learn anything else. So
and the hours are different too.
Yeah.
And
the hours are different.
They're totally different between different schools.
Yeah.
And I used to practice in New Jersey, and that is like a state with like the strictest laws. So like even my medical assistants couldn't inject lidocaine for my surgical patients. They couldn't do like procedures such as lasers, light-based technologies, energy-based technologies. Like I literally had to do everything because of the strict rules, which is not a bad thing, but in North Carolina, the laws are so different. So I was just floored with like how much more relaxed it was here compared to up north.
Well, there's also, like you mentioned, laser techs, but there's also people calling themselves like aesthetic therapists.
Yeah, like
what is that? What is that? Is that even a certification?
They have no.
I don't think so.
Yeah, because laser tech, like I said, is a generalized term. It's not. You did not go to school for your laser tech degree. That's not a thing. It's not real. So how you learn lasers is you learn with a provider. You do go to these trainings with these companies who provide these really qualified, providers, whether they be RNs, doctors, PA, whoever that is. They've been trained by the company. They train you. It's a very structured process. So it's just insane, to call yourself a laser tech, but what additional education did you do? Like, what else is there?
Yeah.
And that's crazy. Like some people that I have met who are laser technicians, I just ask them basic things about the physics, like the wavelength and, the pulse duration, the joules and everything. They're like, oh, this is like the preset instructions. I was just told to do this for XYZ condition. They have no idea what they're doing. They're just literally pushing buttons that they've just been instructed by someone.
Oh, this is bringing me back to trauma. Oh my gosh. I actually had a laser treatment done on my face, and we ended up finding out later on that the settings weren't correct for my skin type. Thankfully it was under versus over,
We've seen a lot of that too. Yeah.
We've seen a lot of under treatment, I would say, which again, I would
rather be undertreated, overtreated any day, all day.
Yes.
But
that's kind of a waste of your money too.
Yeah.
You pay for all that treatment and then you don't really get a great outcome.
Cough, cough, ideal image, cough, cough, lays away, cough, cough, Milan.
But, on the flip side, like when you are overtreated or like very aggressive with settings, I've seen literally a girl, her entire legs is like zebra stripes.
Yeah, me too.
Because they forgot to switch from an Alex wavelength to an ND YAG in a skin of color patient.
Yeah.
Big no-no.
Yeah.
Yeah, and to speak on that, I mean, there's so many things that go into when you're deciding what settings to use, or you want to know what's their sun exposure history like. What do you tan easily? Do you burn easily? Where
your ancestors from?
Yeah, where your ancestors from? I mean, you want to ask the nitty gritty. I am not afraid of asking. So, like, what's your ethnic? Where are you from? Like, where were you born? Where are your parents born?
Because even if you're fair, you still have the propensity to tan like what your ethnicity is, right? So especially like even in South Asians, right? There are some dark South Asians and there are light South Asians. Some of the light South Asians, you can't really even tell between Caucasian patients.
Yeah.
And if you treat them the same way, you will get hyperpigmentation or burn.
Yeah.
Like I've seen that happen time and time and again. Same thing with Hispanic patients. Same thing with Middle Eastern patients.
I have a cousin,
African
red
American.
hair.
Yeah. It's genetics.
Yeah, it's the racially ambiguous, and that's why you want to be forthcoming, with your provider, and then as a provider with your patient to say, okay.
And as the world becomes more diverse with more mixing, more biracial, multiple ethnicities or whatnot, you really can't tell between some patients. And it's always better to be safe.
Yeah.
Yeah, especially in the US, like where we just are a melting pot. I think it's so important.
Yeah.
Yeah. Well, I think this was a great discussion. I feel like the public really doesn't have a firm grasp about the medical providers that they're seeing and what certification educations they have, especially in aesthetics. It's very ambiguous.
Yeah.
So hopefully we, shed some light on, the various different providers that you may see, what their qualifications are. And, some parting words. I think that it's really important to do your research, do your due diligence. I mean, this is your health, it's your skin, it's your face. I do think it doesn't take that long to do a Google search and kind of find, information about the provider. Like it's all public knowledge.
And ask. I 110 times will never mind a patient asking, how long have you been doing this? How did you get your training? Do you feel comfortable? How many times have you done this? A good provider should not blow you off. A good provider should not get annoyed that you are asking those questions. A good provider should say, this is how long I've been doing it. I feel confident. I've trained in this way and that way. So if you're feeling like if you're having that uneasy feeling, leave. You're not obligated to stay.
Yeah, and ultimately, it's not worth getting a complication. That's going to segue into our next episode. We're going to be talking about complications in aesthetics. So until next time, Skinside
Out.
Thanks for listening. This episode of Skinside Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717.